Hi everyone, I'm Dave Basnak from EmergyCare. Wanted to take a couple minutes today to give you a quick update of where we're at with the current COVID-19 situation. COVID-19 is certainly something that's impacted all of our lives. Whether it's your home life or your professional life, you've been impacted and touched by it some way. EmergyCare is no different. We've had to change some of our processes and our daily activities and how we go about doing them. One example, as you can see, is I'm wearing a surgical mask right now. All of our employees, you'll notice, wear surgical masks at all times while they're on duty. It's that extra layer of protection just to ensure that the employee is safe and also the individuals around them are safe. The other thing that we've done over the last month is invest over $50,000 in additional personal protective equipment and decon equipment. That was an unexpected expense. A lot of that equipment had to be brought in from overseas just because of the shortage here in the United States. I want to show you some of the equipment here that we've invested in. A little over a month and a half ago, it became very difficult for us to find personal protective equipment to order. As everybody can understand, the demand for personal protective equipment went up significantly. So EmergyCare partnered with a local company in order to have this equipment brought in from overseas. The equipment still meets the same specs as what we have here in the United States, however, it increased the cost significantly of the equipment. For example, the N95 respirator usually cost about $1 a piece. However, as a result of the pandemic and being brought in from overseas, these are now about $3.50 a piece. Surgical masks, which usually cost about 50 cents a piece, are now $1.50 a piece. So you can see how the cost certainly stacks up over time. We're very fortunate that we were able to find a hand sanitizer here in the United States, so that kept the price to be rather reasonable. In addition to investing in additional personal protective equipment, EmergyCare has also enhanced our decontamination process through acquiring a device called a fogger. This fogger disperses an ozone-based material that helps to decontaminate the back of all of our vehicles, which enhances our terminal cleaning process. Equipment aside, our greatest asset here at EmergyCare is our staff. EmergyCare is made up of nearly 300 employees that are dedicated to fulfilling EmergyCare's mission to the community. Most people, when they hear the name EmergyCare, think of our EMS operations staff, which is made up of EMTs, paramedics, and pre-hospital registered nurses. However, our staffing goes well beyond that. For example, our paratransit drivers. They ensure the safe transportation by wheelchair van or medical taxi of patients to and from doctor's appointments, to the dialysis center for dialysis treatments, or they might be providing transportation from the hospital once a patient's been discharged. Supporting all of our field operations are our communications specialists, who are on duty 24 hours a day, 7 days a week, to ensure that no call goes unanswered. Also supporting field operations is our fleet maintenance department. They ensure that our vehicles are ready to go at a moment's notice and that everything is in excellent, safe working order. Supporting the organization overall is our patient services department, who's responsible for billing and answering any insurance questions that come up. The mission here at EmergyCare would not be able to be fulfilled without all of these individuals doing their job and in place. Throughout this entire pandemic, our staff has worked tirelessly to ensure that these services continue to be provided. Before I close today, on behalf of EmergyCare, I'd like to take a moment to thank everybody in the community that has supported us. Whether it's been through financial donations, through donations of personal protective equipment, or dropping off food, we all greatly appreciate it. If you would like to donate to the Personal Protective Equipment Fund here at EmergyCare, please go to emergycare.org and click on Donate Now. In closing, I'd like to take a moment to remind everybody that medical emergencies and traumatic emergencies don't stop just because there's a pandemic. If you experience any one of these type of emergencies, it's still important that you contact 911. Us, in addition to all of the healthcare systems in the area, have taken steps to ensure your health and safety during your medical care. So, like I said, emergencies don't just stop because a pandemic occurs. If you need help, contact 911 and we'll be there. Thank you, and we're all in this together.